Once you palpate the muscles, if the muscles around the cervical spine is relaxed, so bring the head down to the trunk. Got me? So now you don't need to hold the head. So I'm going to create that flexion using by straightening my knees. It creates a flexion and then coming back to neutral. If I flex my knees and then it comes back to neutral. So you can create flexion and then you can create extension just by moving your trunk. Got me? So you're going to use your hands mainly to control and feel the movement. So if I just palpate, if you see, my hands goes down onto the interspinal space between C2, C3, C3, C4. And if I show you here, if you look at my hand goes onto the C2 and C3, C3, C4, interspinal space, yeah? So once the hand is under there, the patient is relaxed, and if you're comfortable, is it okay? And then you just create that flexion movement and then bring it back to neutral. You're looking at the opening up of the interspinal space, and then once you feel the interspinal space, you come back to neutral. So once you're happy with the C2, C3 interspinal space, so check, you can do 2-3 times and then look for the opening up and closing. So looking at the mobility of the upper cervical spine and then bringing it back to neutral and looking at the smoothness opening up, like how smooth, rhythmic, slow movement you could, checking the quality and then the quantity of movement. With me? So once you're happy, you go on to the next level. So my finger goes down to C3, C4, C4, C5 segment. So place your finger on the interspinal space. Can you see that? Can you see that? So you're going to bring it down, and then from there, is it okay, Joe? So create that flexion, come back. So I'm not using my hand to create flexion. So that's different than using your trunk to create flexion. So my hand I'm using mainly to stabilize the head, and then my fingers are mainly to feel for the opening up and closing up of the spinous process. You got me? So you can, once you're happy with the mid cervical, you can hands goes down to the lower cervical onto the C6, C5, C6, C6, C7 interspinal space. Can you see that, Kev?
Yeah.
And then create some flexion and looking at the opening up. So for the lower cervical is where you like looking at the end range of flexion. Is it okay, Joe? Yeah.
Yeah.
So looking at the last few degrees of flexion is more of a flexion range.
What are you laughing at?
No, I'm not laughing. They're laughing.
What are you laughing at, Gok?
No, I'm not laughing, Joe.
You can't laugh at the client.
Is it okay? Yeah. You got me, yeah?
Yeah.
So the same reference point, same position, but if you go down, you're creating extension. If you bend your knees further down, you're looking at the closing up of the spinous process.
Is that purely from your trunk?
Yeah, I'm purely from my trunk.
Oh, yeah.
Okay? So keep your knees slightly apart, and if you just bend your knee, and then you can create that extension moment. And you're looking at the closing up of the interspinal space and compare between segments. Can you see that? Now, Joe might explain to you, I'm not just using to palpate, I'm just pushing up as well. You see? I'm not just, when I do extension, I'm pushing back just to push to the end range to check the last few degrees of extension.
More extension.
Yeah. Between segments. So I'm using my hand just not to feel, but then I'm pushing up to look at the final last few degrees of extension. You got me? Is it clear?
Yep.
Do you understand what the purpose, what you're trying to do? So that's the screening of the sagittal plane. Do you want to give a try first before we move on to frontal plane, or you want me to show the frontal plane as well?
Try, yeah. No,
Hey,
I don't
none of
know.
this
You
on
try.
none of this on social media. No.
I was thinking.
Don't want it on social media, me. Don't want it on. Don't put it on Snapchat, Kev.
Right, are we just having a try at this now?
Yeah.
You want to try this first before we move on?
Yeah.
Yep. Okay.
What was you laughing at, Gok?